mentioned. But corporations have kind of capitalized on it and appropriated that entire framework, where we think just because we're going to get people of different skin tones on a particular panel, that's going to solve our problem. When in reality, the idea there really is that diversity and inclusion are just the processes. They're not the outcomes that we're after, right? So the outcome there really is social justice. The outcome there really is equity. So that's something I think like folks need to distinguish between the two, that diversity and inclusion are just the first steps and not the end point.
Welcome to the official podcast of the Journal of Science Policy and Governance. In this podcast, students and early career researchers share more about their publication in the journal. Join us weekly to hear from the next generation of STEM leaders as we elevate their voices in science, technology, and innovation policy. Welcome, and thank you for joining us for this episode of SciPol SoundBites, a podcast of the Journal of Science Policy and Governance. I'm Adriana Bankston, JSPG's Chief Outreach Officer and your host for this podcast. Today, we continue with episodes from a joint issue between JSPG and the AAAS Science and Technology Fellowships Program. Authors we're interviewing today are discussing important topics around the COVID-19 pandemic and other broader issues around healthcare and transparency in science. So let's talk a little bit about each publication. We'll start with Chinelo. Chinelo Grace Okenewu is a senior medical officer with the Ministry of Health, Abia State, Nigeria. She has a wealth of experience in child health and is passionate about improving healthcare delivery among vulnerable populations, especially disadvantaged children. She holds a master's in global health delivery from the University of Global Health Equity, Rwanda. Publication in JSPG by Chinelo and co-authors is entitled Ending Child Marriage in Nigeria, the Maternal and Child Health Countrywide Policy. So can you tell us briefly a little bit more about what your publication entails?
Okay, thank you for having me. We worked on the policy ending child marriage in Nigeria. We proposed the policy option enacting maternal and child countrywide policy. Child marriage is a very serious issue in Nigeria. Like I said earlier, there are about 22 million brides who are under 18 years. And this affects their health, it affects their mental well-being, because a lot of them are prone to emotional violence, psychological violence, physical violence, sexual abuse. They are deprived of education because most times their parents force them into marriage and they are forced to drop out of school. So they are deprived of education. And when they get pregnant, they are prone to complications during childbirth, such as obstetric fistulas and things like that. And they have higher chances of dying from complications of childbirth. They also go through a lot of psychological distress because they are prone to domestic violence. This issue is a very major concern in Nigeria because it's founded on a lot of cultural and religious beliefs in some parts of the country. And we propose this policy in order to get the government's attention towards this problem and to do more in order to bring an end to this, because we have found out from past research that there is a correlation between child marriage and maternal mortality. And because of that, the records have it that a reduction of child marriage by 10% can actually lead to a reduction of maternal mortality by 70% in the country. So we hope that this policy will actually bring about a reduction in maternal mortality, in child mortality, and also to improve the child rights, especially for the girl child who people consider as more inferior to the boys. So we hope that this will address this issue, this harmful practice in Nigeria, and reduce the number of child brides that we have in the country. So our policy aims at, the policy we recommended is the maternal and child countrywide policy, which entails elevating issues related to maternal and child health to matters of national security, in which case the government will give priority to these issues and ensure that the laws or policies that are related to improving maternal and child health are implemented in all the states. By so doing, we hope that there will be a drastic change in the number reduction in maternal and child morbidity and mortality.
Yeah, thank you for that. I have to say that I didn't know a lot about this issue before your paper, but it seems like it's very complex and there's a lot of layers to this and regulation and issues that compound upon each other. So one question is, who are the different groups that are involved? So is it just the local government, or do you think the solutions to these problems involve different stakeholders? Is it government? Is it agencies? Just curious if you have kind of a broader answer.
Thank you. That's a very good question. This problem is a multifaceted problem and requires a multi-sectoral approach that will cut across different ministries, parastatals in the country, from Ministry of Health to Ministry of Education to Ministry of Women Affairs and Social Development. We also involve the policymakers. We need the parents and the grandparents who are key stakeholders in this issue, and also the girls who are involved. The community has a large role to play in combating child marriage. And importantly, also, we need to understand the roles of the religious and cultural leaders, because they are the custodians of some of the cultures that promote child marriage. So we need to involve all these people and engage them in a platform where they can actively address this issue of child marriage.
Mm-hmm. Yeah, that makes sense. So you mentioned a little bit about education and the parents. I'm wondering if you think, or if there's ways that this could be addressed just by educating either the girls or the parents about these issues, or is that something that's being done now or could be done better, and how would you improve that?
Education is very important in reducing child marriage, because it's been found out that the longer a girl stays in school, it reduces the chances of her getting married before the age of 18. So we also proposed a policy to extend free education. Currently, Nigeria has a free education plan for primary school. So we're also encouraging the government to extend this free education scheme to the secondary school, so that girls can benefit from education, from getting free education, and that will prolong, reduce the chances of them being married off at an early age. So I think education is very key. And also we hope that we engaging the parents too will make them understand the harmful effects of child marriage on children, because in some places they still don't understand the extent of damage this can expose these children to.
Yeah, thank you for that. It seems like a really important and complex issue. So thank you for teaching us about that and telling us about your paper. So we'll move on to John. So Jonathan Klonoski is an F31 grad student research fellow employing a combination of computational and biological tools in order to investigate the role of ciliary signaling in heart development as it relates to structural heart defects. Jonathan is the acting president of Pitt's Science Policy Group and on the Diversity, Equity, and Inclusion Committee for the NSPN, where he channels his passion for further integrating traditionally underrepresented or marginalized communities into policymaking processes. The publication in JSPG by Jonathan and co-authors is entitled Strengthening Transparency in Regulatory Science, the Environmental Protection Agency's Proposal to Internally Regulate Science. So John, can you explain a little bit more about your paper?
Yeah, definitely. And I'd like to thank you guys, JSPG and AAAS, for having me. We were kind of looking, and we see a lot of times during the Trump administration, a lot of sensational things are happening that people get outraged about. And we saw this rule proposal that was being kind of lambasted by many groups Yeah, it was, yeah, lambasted by many groups as being a very negative rule change. And so it was this strengthening transparency and regulatory science coming out of the EPA. And the idea behind it was that the EPA, the purported kind of idea behind it was to increase the citizens' trust in science by making the data that's used for regulations within the EPA available to the public. And furthermore, they wanted to address issues with the peer review process, because you know, we all, as scientists, we know that there is issues with replicability in science. And so they wanted to address that so that the science going into regulation is sound and logical and can be replicable. Unfortunately, reading the kind of rule, we quickly saw that it seemed like there was just no input from scientists, and it seemed like it kind of followed this this pattern that we saw where the administration would appoint let's see, businessmen, people from industry, not necessarily even from science, to head these regulatory agencies. So we were under the impression that, hey, maybe they didn't consult any scientists. And as scientists, we have a lot of input that we can give towards this matter, and we can help out with these recommendations. So we approached it from this kind of constructive view that, yes, there's a lot of glaring issues, but the underlying principles made sense. And if we could just work with the people who are in charge of this rulemaking process, we can come to consensus about it. Yeah, unfortunately, since then, you know, and that's kind of how we approached our memo. But unfortunately, since then, it doesn't actually seem like that's the case, that there are a lot of avenues for scientists to put input. There are a lot of scientists at the EPA, and they have just been shut out of the process. And there's some other nefarious things that go on. But we kind of wanted to focus on what are the constructive things and what would the EPA have to do to make this a working order rule.
Okay, thank you. Yeah, that's really interesting. Two things that come to mind. So you mentioned the EPA specifically and having this issue of there's not a lot of scientists. Is this something that's specific to this agency, or is there data about what this looks like in other government agencies?
So actually there are. So the EPA has a vast network of structurally, like, advisors and boards and people who review policy, review science and how it relates to policy. So those people are already there, but a kind of hallmark of the Trump administration, as we can see through the processes like this rule proposal, has been trying to circumnavigate and take those scientists out of the picture. And we can see that on one hand, they're saying, you know, we should have a transparent process that's replicable, that uses science that can be repeated. But on the other hand, what they're actually suggesting in the rule is things like consolidating power away from scientific advisory boards and on to political appointees. And so we wanted to point out that, look, if you want to increase citizens' trust of the EPA and the regulations, the citizens actually believe and trust in and have confidence in scientists at levels much higher than other people, such as business insiders, elected officials, and this is based on a Pew Research poll. And so we said, look, you're doing the opposite of what you should be doing. You should be continuing to invest the power of how science is used in regulatory science to scientists and not to appointed officials. Because as we all know, but I may want to point out that the EPA is a department under the executive branch, and there are no elected officials that act there. Instead, we have elected officials passing laws, and then it's up to the departments to instate the policies, the rules, the processes that actually enact the laws.
Yeah, that makes a lot of sense. So I think a lot of what you're saying is very relevant to today's landscape, both in terms of COVID times and with the changing administration. So I'm curious if you have comments about if you think this will change with the new administration, and whether public trust in scientists is better now, or has COVID affected that at all?
Yeah, definitely. Yeah, I mean, starting, I guess, from the last question, working our way back, I'm not sure how kind of trust in scientists has changed, but I can't, because it's been steadily increasing over the years from 2016 to 2019, from 76% of people to 86% of people. But yeah, it's not helpful when you have such divisiveness and kind of a choosing of who's trustful and who's not based on affiliation of some sort of political, or some political affiliation, or who's supporting your interests. But kind of what I think that can be taken from this is through the transition, and what we can learn was that actually the Trump administration was pretty smart, because unlike the Obama administration that would hand down memos to departments being like, we suggest that this is the way you approach these policies. And so usually the president will hand out these memos, and these are non-binding recommendations, as opposed to what the Trump administration has been doing, which has been using the rule-changing system to change the rules, and those are actually binding. So the president comes in, he said, don't follow all of the Obama suggestions, and he's going through a formal process that takes a long time to formalize these policy decisions. And so kind of what I want to communicate from that is that there's a lot of ways in which policy changes and laws are enforced, and we have to be cognizant of those, and we have to use those tools in our toolbox. So kind of going back to the transition, unfortunately, a lot of rules, and this one right here, the strengthening science in regulatory science, strengthening transparency in regulatory science, if it passes, it will just be that much harder and would take that much longer to undo. Yeah.
Okay, great. Thanks for that really good answer. I think there's a lot of layers here, but definitely we should think about this public trust in scientists too, because I think that hopefully it'll be increasing with the new administration as well. So thank you. All right, so we'll continue with the COVID theme with Priyanka. So Priyanka Bushana is a PhD candidate in neuroscience at Washington State University Sleep and Performance Research Center in Spokane. Her studies investigate the relationship between sleep and antioxidant mechanisms in the brain. She's a co-founder and the president of her local science policy organization, Health Science Student Advocacy Association. As a recent member of the steering committee of the Public Health Action Coalition's team of Spokane, Priyanka is interested in grassroots advocacy and education around advocacy which supports the healthcare needs of her communities. The publication in JSPG by Priyanka and co-authors is entitled COVID-19 Exposes Urgent Inequities, a Call to Action for Healthcare Reform. So Priyanka, this topic is really critical and timely. Can you tell us a little more about the inequities that COVID-19 has exposed and how your memo is addressing this?
Thanks, Adriana. Yeah, so we've seen that many populations have been disproportionately impacted by this virus, including Black, Indigenous, low-income, undocumented immigrant, incarcerated, and disabled populations. And those disparities are exposing underlying inequities in healthcare access and utilization, as well as so many other things like housing and occupational differences. That's why so many of these minority groups that I mentioned are now considered essential workers and are being exposed to COVID-19 at higher rates. And because there are so many disparate populations that are falling through the gaps at this time, it's really important to have community stakeholders that are representative of those marginalized communities and who can be well connected with each other and to well-established government resources. Those community stakeholders are important in that they'll be in the best position to voice the issues that they're directly observing in their communities. And we believe, so we addressed our policy memo to the Department of Health and Human Services because HHS has shown that it does have the capacity to take this issue on. In the past, it's established community relationships during projects like EHE, Ending the HIV Epidemic, and PEPFAR. Both of those are projects that address the AIDS and HIV epidemic. And our proposal posits that the same mechanisms should be expanded upon and institutionalized so we don't have to reestablish those relationships time and again for every health crisis. There have been experts that characterize our national response to pandemics and disasters as panic, neglect, and we are focusing, in our memo, we focus on ending that neglect cycle, using that panic to come to some stable change for the future.
Great, yeah, so that's an interesting point, going off of Jonathan's point too about community engagement and what Chinelo mentioned too. So it seems like this is another dimension in addition to what policymakers can do and involving the community and advocacy and working on these things. So I think there's been a lot of discussions from what I've seen about how COVID has changed healthcare, as well as inequities in general. I think there's a lot of things we could be discussing here. I'm wondering about sort of the scope of this in your memo, or how you think this could be addressed, because it's something that affects different stakeholders locally, nationally, even globally, right? So how do we address this in the most efficient way? I guess in your memo did point out some ways. Do you think that this is different in other communities, and are specific groups affected more by COVID?
You mean different communities around the world? Yeah, that's a really great question. I think that there are other communities around the world that experience these problems in different ways, but I think the base problem is a lack of institutionalized, standardized, change. So other communities, so marginalized communities are always the ones who bear the brunt of problems that come up during these epidemics and pandemics. And I think that we've fixed this problem so many times in so many different ways. So one of the ways that our policy memo addresses, standardizing those changes is by just changing data reporting structures. And I think that people around the world are reckoning with those reporting structures. There's been, in the past few decades, there's been a big push to change the way that health records are treated, electronic health records. And in our proposal, we suggest requiring that social determinants of health and equity are reported in those reporting structures so that we can identify where the communities that face the most troubles during these times are, and we can target them effectively whenever national level problems arise. I think that other countries are doing similar things.
Yeah, that makes a lot of sense. And you mentioned patient data earlier too, and I know there's a lot of regulations related to this. I'm wondering what is the most useful data, or there are also restrictions to what can be shared? Is demographic information something that is open? And just generally, are there any comments that you have about collecting this data?
I believe that generally de-identified data is open, but it is hard to acquire, and a lot of that has to do with still this lag in standardizing the way that data is acquired. So I should say that those social determinants of health data, social determinants of equity data are being collected by a lot of labs and hospitals already around the United States, but the way that they're collected and the way that they're reported is not standardized. So that's where it becomes difficult to aggregate them and make large-scale decisions on a federal or even state level.
Yeah, thank you for that. So since we're on this, I actually want to ask Chinelo this question too, because it seems like how, in terms of data collection around the world, I think this is also interesting. How is that documented for your particular memo and your issue? Because I'm curious how they collect this kind of data.
Actually, there's a dearth of data on child marriage in Nigeria. We don't have actual data on the correct issues, especially from the key stakeholders who are the traditional and the religious leaders in those regions where the child marriage is very common. So we have to make more efforts in terms of data collection to help in-depth understanding of the root causes and the factors associated with child marriage in Nigeria.
Yeah, I think data collection is probably helpful for a lot of these topics that are plaguing our entire, not just our country, but globally now as well. So thank you. Okay, so we'll move on to Ans Irfan, who is a public health scientist, faculty member, and a dual doctorate student. He also serves as the policy director with the PH Coalition. The publication in JSPG by Ans and co-authors is entitled Inclusive Policymaking Tools, a COVID-19 Pandemic Case Study. So continuing with COVID-19, tell us a little bit about what inclusive policymaking means and how your memo is addressing this.
Sure. First of all, thank you for having me with these wonderful people. And I feel like Priyanka covered everything that I was going to talk about my particular policy memo. So it could have been an appendix in their policy memo. But the sort of like, our underlying thesis there really is that we don't tackle the ingrained inequities in our policies, and almost always all of our policies are inequitable. And part of that is they're not inclusive in their very nature. Either they were developed by people for people who are not coming from marginalized groups, or populations who experience vulnerabilities because of structural issues. And more often than not, it has been either white people generally or mostly white men. And so our sort of approach there really is that if we want an equitable society, it's a just society, a fair society, we should be engaging communities in a more meaningful structural way. So that's what we really mean by an inclusive policymaking process. So it's not an afterthought, it's just that it's hard work, and we're not suggesting that it's easy by any stretch of imagination, but we basically went out and put together a list of different tools that policymakers, policy advisors, or scientists more interested and involved in the science policy sphere can use some of those, any combination of those, to sort of like when they're in the policy development and implementation process to make the policies a little bit more inclusive, and hopefully that will lead to a slightly better world than we have right now. So.
Yeah, so I'm curious if you have any specifics. So one of the things that I always think about is, and I don't know if there's an answer to this, is how can we empower these communities? Because a lot of times, even within institutions, people say if you have a diverse committee, they'll put people from different parts of the world on there, or different cultures, and say, okay, we solved the problem of diversity because we now have, a certain culture there. How do we think about empowering these people without being sort of overburdening, right? So I can see that if you have one person kind of representing the whole culture, then that person, there's a lot of burden on them, but also we need to create this place systems where they can be empowered to do some of this work. So I don't know how that, if you can comment on that, because I think it's really important to think about inclusive policies with all of these topics. And so I'm curious if you have any comments about how to do that without feeling like you're burdening the people that you're trying to empower at the same time.
Yeah. I'm not sure if I have any comments on it, and I welcome rest of the panelists to sort of like, chime in. But I will say is that a couple of things about it. I think like diversity, equity, and inclusion, it was started fairly well-intentioned. But corporations have kind of capitalized on it and appropriated that entire framework, where we think just because we're going to get people of different skin tones on a particular panel, that's going to solve our problem. When in reality, the idea there really is that diversity and inclusion are just the processes. They're not the outcomes that we're after, right? So the outcome there really is social justice. The outcome there really is equity. And so that's something I think like folks need to distinguish between the two, that diversity and inclusion are just the first steps and not the end point. So when we bring people in, then we create an environment to let them work within that environment and dismantling a lot of these systems of oppression and rewrite a lot of the policies, which really are rooted in genocide and enslavement of human beings. So thinking about that, like acknowledging it and then sort of like allowing people that space to sort of like recreate and basically burn it down and build it back up. And that's how we think about the equity part and social justice part of things. And then the second thing I would say is that this is something that, often I find almost amusing in the US context, because I'm a migrant to the United States. I keep hearing this term about, community leaders, we engaged community leaders. Now, I'm not against it. Obviously, like we need to be reaching out to community leaders, and that's very important. But that almost reduces a lot of these communities and their diversity down to some monolith that if you're going to talk to one person, that's going to fix it. Like I've never heard anyone talking about, let's talk to white community leaders. I don't know if any of you have had that experience. They're like, I want to do a project. Let's talk to white community leaders and engage them. Like never occurred to me in all my years of working in this space, right? So thinking about that, we don't reduce all these communities, and they're like really beautiful diversity within those intellectually and otherwise, down to sort of like few folks, and engage them in a much more meaningful way and do it more methodically and structurally to sort of like, really lead to dismantling of systems.
Go ahead.
To add to that, if I could. So I agree completely with what you're saying, Ans, and I've never heard it put that way, but makes perfect sense to me. In terms of not overburdening sole representatives or community leaders of minority populations, I think that there is a really simple answer there, and it's just to ask those leaders who they're comfortable with representing and advocating on their behalf, on behalf of their communities, because those leaders have developed relationships outside of their own communities with other powerful allies. And if they feel that there are other people within their communities or outside of their communities who understand their concerns well enough, they don't have to take all the work on themselves. Giving them the space to pass that work on, I think, is equally important.
Yeah, I think that's a great point, and it's important to address these issues now in terms of inclusive policymaking and community engagement and what that means for different groups, which seems to be a common theme here. So I want to ask John this question too, because since you're involved with the DEI committee, so how do you see this kind of from the early career perspective?
Yeah, definitely. I think you have to start by building trust. I mean, you have to start on that early career. You have to start earlier than early career, pre-career, because a lot of what happens is that the policies that and the structures that have been in place have abused and left scars in communities, so that they don't believe they can take part in these systems. They don't believe these systems are for them. They don't trust these systems. And why should they if there's all these examples of how they've been taken advantage of? And so I think what's really important is that you have to go into these communities, and you have to kind of do a lot of PR. It's whether it's partnerships, whether it's using these kind of toolkits and engaging these communities as like one of those ways, whether it's some sort of, just showing up to the classrooms and talking to students. So if we're talking about science, providing the role models there, to kind of show the community that these different communities, that there are people they can look up to, that they connect with, and that these are actual pathways that they can take, and that these pathways lead somewhere. Because, and I don't think it's enough to just say, oh, well, we should have a program where, we take some students and they, if they go through this, like it's a bridge program, from like high school to college, or maybe college to graduate school, because you have to think of alternative ways that isn't exclusive, right? So who's gonna end up in these programs? People who know about the programs. Who knows about these programs? The people who already trust the systems and know about the systems and know how to navigate them. The problem is getting those people that don't know how to navigate the current systems there already, and get them to participate. And so a lot of that is building trust and providing role models and things of that nature.
Great. Yeah, thank you for that answer. I think, and I always like to ask this question about the early career, because I think it's important to think about how we're engaging students and people who are sort of coming, undergrads and coming into the policy space, and how they can contribute to making it more inclusive. I think all of you guys have done this with your memos as well. So I just want to kind of end on this theme, and if anyone else has advice about how do we train this next generation to think about DEI in policy. Ans, you want to answer that? Start.
Sure. I could. I joke with my friends that I'm gonna quickly turn into persona non grata, because I'm like, especially folks coming with their PhDs into science policy sphere. I think we teach people a lot. One of the things we don't teach them is the unlearning process. So I would just say that, so one of the arguments we make in our policy making is this notion of positionality assessment. How do you be self-reflexive, right? So gaining your PhD means that you have exceptional knowledge and no one is questioning your brilliance, but that is in that limited space that you learn from, right? That is not necessarily applicable to a lot of other things. So having certain degree of humility and thinking about that, I do need to unlearn a lot of the things that I've learned, and then learning from the communities, because communities are experts in their own issues, and they can provide you those meaningful expertise and ideas, which should be equally as important as some technocrats. Like I can collect all the letters in the world behind my names, and it means nothing because I'm not an expert in communities' issues, right? So it would come from the community, and having enough sort of like reflection to think about that, how do I engage this community in a meaningful way through a qualitative process to understand the context, and then moving forward with it, I think is a really critical skill that everyone should be actively thinking about.
Yeah, thanks for making that point. That was really blunt. I'm glad you you said it that way. So I'm going to ask Chinelo this question too. So since it sort of flows well from what you're saying about how do we educate communities to engage in this and be more active, what are your thoughts?
I think an important thing about engaging community is building trust. Just like John has said, if you don't gain their trust, you may not be able to impact anything on them or even help them in any way. So it's a gradual process. You build trust, and then from there you start educating them on the necessary things that they need to know. Building relationships over time, helping them in addressing the issues that are problems, like identified problems in the community. That way you can really engage them in learning, in the process of understanding what they need to know about the particular issue. Thank you.
Great, thank you. And then Priyanka, any last words? What are your thoughts?
Yeah, I think what everyone said here is really important, really powerful to note. I think to add to what Chinelo says, I think part of building the relationships with communities is really putting the sweat equity in, just being there for those communities, listening to what they need, and supporting them where they say that they need support. Building those relationships isn't something that can be done overnight. It takes time, and I think that building solutions that address equity and inclusion similarly take time. You have to do your research, you have to do your homework, and you have to show up and listen before you can just jump in and solve everything.
Great, thank you. I think that's a great point to end on, and thanks to all of you for these really insightful thoughts today and this conversation. So thank you to our audience for joining us today. You can find this episode and others like it on JSPG's YouTube channel and on SoundCloud. And that's it for this week on SciPol SoundBites, the podcast of the Journal of Science Policy and Governance. If you enjoyed this episode, subscribe to our podcast on YouTube and SoundCloud. You can also follow us on Twitter, Facebook, and Instagram at SciPol Journal.